A common health concern in recent years is lactose intolerance and the impact that food has on our digestive health. Lactose intolerance can be really confusing. How can they tell the difference between a normal digestive, like upset, and lactose intolerance itself?
Right. No, that's a great question. And it can be confusing, right? And I think with any type of GI situation, you kind of have to tease out what it's not and then work to kind of correlate it to, well, what might be causing this? And so I think lactose intolerance kind of falls into that same category, right? So to understand, I think first is to recognize what lactose intolerance is. So, like the name suggests, your body actually isn't able to break down lactose effectively. So, there's a little enzyme, and it is called lactase. And so, that lactase enzyme breaks down that lactose carbohydrate strand. It's really long. And so, for your body to be able to use that carbohydrate or, lactose source, it needs to be chopped up so your body can digest it properly. Without lactase, that isn't happening. So your body instead is having that lactose kind of reside in your, intestines. And so it's going to not be broken down appropriately. And that then leads to common symptoms that patients might be describing. Their families might be, hearing them express, oh, my stomach hurts, or, maybe I'm having struggles with my stool. Maybe it's either I'm constipated or the reverse of that, I'm having diarrhea and it's just really uncomfortable. And so that being able to, I guess, take note of those symptoms and then look to see if there's any tie in with lactose containing foods. And in terms of the dairy category, the food that has the most lactose is going to be liquid milk. And so a lot of times, parents might be able to correlate that with, okay, my child is, drinking, maybe it's a lot of milk. And then I'm noticing, these GI symptoms. And then that would prompt, I would hope, a conversation with that pediatrician of, this parent identifying this and bringing that to the healthcare provider and saying, I've noticed this. Like, could this be related?